Hi all, I hope you all doing okay. Let's talk about some of the Saudicouncil exam questions. A pregnant client is making her first antepartum visit. She has 2-year-old son born at 40 weeks, 5-year-old daughter born at 38 weeks, and 7-year-old twin daughter born at 35 weeks. She had a spontaneous abortion 3 years ago at 10 weeks. Using GTPAL format, the nurse should identify that the client is. The correct answer is G5, T2, P1, A1, L4. So why G5? Because she's pregnant. So G means how many pregnancies she has. So she's pregnant now, that is first one. She has a 2-year-old son, that is the second one. She had a 5-year-old daughter born at 38, that is the third one. 7-year-old twin daughter, that's another pregnancy, and she had a spontaneous abortion 3 years ago, that's another pregnancy. So total of 5 pregnancies. Then term pregnancies. How many term pregnancies she has? She has 40 weeks one and 38 weeks another one. 35 weeks is not considered as term pregnancy. Up to 37 is considered as term pregnancy. So she has preterm is 1. That is 35 weeks. Preterm, that is 1. A is abortion. 1 abortion. She has 1 abortion and living 4 children. What about living 4 children? This is 1 child. This is the second child, and these are the 2 other children. So living is 4 children. The 10 baby boy is admitted to neonatal intensive care unit. Physical examination read flattened nose, low set ears, upward slanting eyes, single transverse palmar crease. Which of the following is the possible diagnosis of the newborn? So the correct answer is Down syndrome. So these are the signs of the Down syndrome. When assessing a newborn weight in weighing scale, the nurse must avoid conduction. Otherwise, the temperature will go down. Conduction. She should avoid conduction. So she should cover the baby very well. A multiparous patient on day 1 postpartum is asking the nurse to send her baby to the nursery so she can sleep. What is the most likely phase of psychological adaptation? So taking in. First 1 to 2 days is called taking in. Here she's concerned about herself. She wanted to take care of herself. The second phase is letting go. That is the time she is trying to adjust with the baby. 65-year-old woman visited the gynecological outpatient. History reveals that she had 3 pregnancies, 1 abortion and 2 normal deliveries. She smokes 20 cigarettes per day. She complains of wetting herself while coughing. Which of the following can be considered as the risk factors for pelvic floor muscles? The options are chronic coughing, diabetes mellitus, excessive sport, and sedentary lifestyle. So the correct answer is chronic coughing. That is the one affecting her pelvic floor muscles, the weakness, and then she wets. A 27-year-old insulin-dependent diabetic mother has delivered normally at 38 weeks of pregnancy. The nurse was assessing the insulin requirement of this mother after delivery. What is the insulin requirement for this patient? Higher than before pregnancy, no changes, lower than when she was pregnant, and slightly increased than before delivery. So the correct answer is lower than when she is pregnant. Thank you, and we will see you in the next lesson.